Hey everybody, I'm Jody Vance.
And I'm George-Affleck.
And it's time for...
Are you ready to rumble? It's election time! Unspun.
Hold on, I think maybe you did...
Have I done that one before?
I think it was it 2 years ago? Feels like 5 years ago, but it was 2 years ago. Maybe it was last October. I'm losing track. So many elections.
Becoming redundant, but so are elections.
Maybe it was November. Maybe it was November, and it was a U.S. election. I don't know. I don't know. Hi, George.
Anyways, I love election night, and I'm looking forward to Monday. I totally nerd out on this stuff, and so it's and then when I find out where the parties are locally, I sort of crash them. And you go to the loser one, and then you go to the winner one, because I'm not involved in any campaigns in this election, so it's kind of fun because you can just kind of. You find out where they are, and then you just kind of walk in, and it's cool.
That's cool. Well, I will be in Montreal, so I will definitely either be in a very happy place for one candidate or a very unhappy place for one candidate, because I will be where Justin Trudeau is with Al Jazeera English. Which, by the way, you're going to be doing some political debrief with Al Jazeera as well on the digital side.
I know we're taking over the world now. You and I.
Yeah.
Thanks to you, I'm going to be doing some punditry with two other journalists in Canada, talking about the Canadian election for the international audience. So it's kind of cool. So that's coming up. It'll be have been recorded. It's live, but then it'll be on Al Jazeera. So check it out.
Be on the digital platform of Al Jazeera, which you should have tagged anyway, because you know what? We are helping to educate the world about Canadian politics, and it's interesting. Because when you think about how in it we are and how in places around the globe, nobody has a clue what's happening here. So Unspun is ever more important, I think. And honestly, I don't take that lightly, George, because there are people who live in this country who have no idea what's happening right now, which is also why Unspun is really important. Why following you on Twitter at George _ There have been sound effects that have added to that over 138 episodes of this program. I'm at Jody Vance, Jody with a Y. And we do want to start. We're going to go federal, provincial, and then get hyper local, because there's a bunch of stuff going on that I'll tell you about my column as well. But let's get into the federal politics right now. As you mentioned, we both love to go a mile wide and a mile deep on this. We have to. And up until really the last couple of days, it was like, wow, this is a horse race I've never seen so tight, given the fact that we've talked about it before, George, that internal polling for the federal Liberals had to have shown that they were an easy cakewalk to a majority to even call this election, but no. And now a huge turning point. Why don't you lay the groundwork on what happened after Jason Kenney had to call a state of emergency in Alberta because hospitals are days away from overflowing, thank you to him lifting everything on Canada Day so the Calgary Stampede could go ahead. And the fact that he was praised by Conservative leader Erin O'Toole at the time, and now that is not a recipe that works well politically.
I know, and it's funny because last time we spoke, I think it was last or the time before, and that was the moment, I think it was the debate moment where I said Trudeau kind of pivoted. It was actually, it wasn't in the debate, it was in the Q&A afterwards, and I said this is a moment that will be very effective in he was talking about the right-wing media, rebel media, and how, he didn't want their question.
Didn't even call them a media, said you're an organization. No.
That's right. So that was an interesting pivot, and it kind of addressed his base. In this case, this week, also helpful to Trudeau is this issue that you mentioned with O'Toole saying he was supportive of Kenney's decision way back in July to open up the province and go full bore without any care in the world. And that's come back to bite Alberta big time, as predicted, certainly by, I think Bonnie Henry was a bit cautious in her words back then. And she didn't want to throw her pals in the other province under the bus, but it's the numbers are terrible and it's the worst in Canada. Although, BC is not that great compared to Ontario when you look at the data, but at least we aren't filling up our hospitals. And so, the thing that was painful when we talked about the spin though this morning, and this happened this morning or late last night with O'Toole not answering the question, about why he, his thoughts now, and does he support? Does he still support the Premier of Alberta? He used to support it. Now, what do you think? And he totally deflected so badly. He sort of said, this election was called during a pandemic, and that's a bad thing. Try to spin it in a way that's like,
Yeah.
That's not spin, that's lurching. Every single journalist like, dude, you're not answering even close to the answer. And
No.
I don't understand. We talked about this before the show about throw him under the bus. What are you doing? Why do you need? But the thing is, he needs Alberta, and he doesn't want to. If he starts, if he pushes people to the People's Party in Alberta, you'll end up seeing liberals. He'll get those people in. You're showing up a brochure.
This just showed up in my mailbox just now, where the People's Party of Canada is aligning a vaccine passport with residential schools. It makes me physically ill that this image exists in terrible. This country. It's so tone deaf, I can't even handle it. And the fringes are,
but the fringes benefit Trudeau.
Exactly. And the fringes are playing a part in this now. The parties that have no possibility of taking power have a significant impact because of what just happened. Okay, let's unpack it just a little bit further. If he gets 2 or 3
seats and party status, that's going to be nuts.
He is Maxime Bernier.
As in Maxime Bernier.
So let's just go back to Jason Kenney, the Premier of Alberta, and the federal Conservative leader in Erin O'Toole. Back in July, when Jason Kenney made the announcement that they were lifting all restrictions, they were not even going to do contact tracing anymore. You were not even being asked to stay at home if you tested positive. That was for me like, why would you say that? I felt for the provincial health officer there, Dina Henshaw, because I was watching her deliver that and thinking she cannot be saying this.
She's holding her crossed her fingers behind her back. And I'm like, this is not
right.
Me.
And now has come out and apologized to say, I wish I'd said something differently, because she knows people.
She could have walked away. She could have quit. She could have taken a stand. Sorry,
right,
Tina, come on.
Right.
It's your job.
Indeed. So there's part of this as well. But the difference between a province led by science and a province led by politics. And we have seen this happening in Alberta. And on that day, on Canada Day.
United States.
But on Canada Day, when Jason Kenney did this magnanimous, and everybody, I shouldn't say everybody in Alberta, I take that back, wipe that out. The people in Alberta who want to be that person with Jason Kenney, there are a lot of anti-vaxxers, disinformation, misinformation, anti-science folk in Alberta for whatever reason. That is just statistically true. And that's his base. And now that he has, George, when I watched the Premier of Alberta yesterday say, we got it wrong, I'm sorry, I was like,
hey, it worked for Gregor Robertson once. He won another election with apologizing 2 days before an election for being a terrible mayor. Sorry, I'll start listening now. He was also holding his fingers up.
So,
his back,
this might save Jason Kenney, probably not. But what does it do to
he's got
Erin
a long time till his next election, so it's a lifetime.
But Erin O'Toole being asked, as you said, that question at the availability this morning, straight up, I think it was David Cochran from CBC News Network. He's in on Power and Politics for Vashi Capellas, who's on maternity leave. And he was just straight up with the question kept coming. And he was like, Mr. O'Toole, I need to know the answer to the question, do you still support that move made by Premier Jason Kenney in July? And he immediately said, I blame Justin Trudeau. And it was like that. And then they cut the light of the media people.
That's one approach. He should have done that right away. That's what he should. Instead of saying something about, you just say Trudeau's got it wrong. The province's ability to make their own decisions clearly is creating an inconsistent pattern. We should be looking at a national model. Perhaps what we should be looking at is our healthcare system in general. Maybe it's broken and we need to start thinking about that. There's your answer. Just do that. And okay.
He didn't do that.
No, he just totally went on about the election.
That was a really good answer though, George. You should run for prime minister. That was a really good answer. Because I would have bought that answer. I would have been like, you know what? As a British Columbian, I look to my friends and family in Alberta. I have family there. And they're terrified of what is happening and how much worse it's going to get before it gets better. There's no fast way to clean up what is happening there. And it's all rooted in politics. And that is going to splash over into the federal.
They're going full on now. So they've accepted their fate of lockdowns, and they're back 6 months ago now.
Yeah.
It's sure, great. You had your rodeo. Hope you enjoyed it. But again, we're seeing our numbers kind of flatten as far as full numbers here in BC, but they're not perfect. We're not perfect here. But we have our freedom to a certain degree in a way now that Alberta doesn't have. So I think that's the key here is you can't be too fast with this. Although, Florida was very similar to Alberta. They're seeing their numbers finally go down, but they went through, we don't even know because America doesn't track it the way. But, I saw in the story that, 1 in 500 Americans have died of COVID.
Not just got COVID. Died.
And I was thinking, that math is not right. I had to actually do the math. I'm like, wait a minute, what? And it's true. So that's not right.
655,000 and counting.
It's nuts.
It's crazy. It's a lot of people. But one of the things I think let's not pivot, but actually plant right here, how incredibly fortunate we are in British Columbia that British Columbians as a whole are stepping up to get vaccinated, because our vaccine numbers because they say the difference between 75% vaccinated and 80% vaccinated is massive. Because when we look at Dr. Tam was talking about, I was listening to her this morning, Theresa Tam, the federal health officer, of course, was saying that, 7 million Canadians are under or unvaccinated still. And that can overwhelm our healthcare system. And Alberta is the greatest ratio of unvaccinated people per capita. And, so we just, I don't know how.
Northern BC is not much better here though.
Right.
But, and it's interesting, I don't know, that we have to, get to 90%. I saw Denmark, I think it was Shane Woodford, they're 90% in Denmark now. So they completely
lifted everything. Up. Yeah.
So you got to get to 90%. We need to get 90. We're still at 76% double vaccination here. That's not good enough. Got a long way to go.
78.6, I think I saw yesterday. Yeah. And in Denmark, what I found interesting, and I think we read the same post by Shane, who lives in Denmark, is that they actually got rid of the vaccine passport scan thing, because he was telling me it just was normalized. You scanned, you rapid test, you did all the things, you scan. You had one for international travel, you went one for your local grocery stores, cafes, restaurants, movie theaters, whatever. All of those are gone now, except for the international travel one, because that's required outside of the country. But he said that even then, the Danish government has reserved the right to bring it back if needed. I mean, and I think that's where we're headed. If we pull back all the layers of throwing mud at one another over COVID, because this virus doesn't care. It doesn't care what we think, or what Jason Kenney thinks, or what Aaron O'Toole thinks, or Justin.
Or what God you follow,
or exactly.
Whatever.
Exactly.
I mean, I have religious friends who refuse to get vaccinated, and I don't get it. I mean, I think that if you believe in God and God, you could argue God has sent you this vaccine. No, I can't. You can't. He sent
That's
you
a
this
really good
lifeline.
point. That's a really good, because
about that,
would those same people go to the hospital if they were profoundly ill or in a car accident or broke their limb? Would they go to the hospital? That's my question. When people are like, God will take care of me here, it's like, with all due respect to your religion, if you break your arm, will God look after you then as well? Or you're going to go to the hospital and get it set and put in a cast?
Mm-hmm. I don't get it. And so we have those. We have the anti-vaxxers. We have the sort of hippie people who are anti-vax in a the sort of Salt Spring Island, Nelson areas where they have this. It's weird. There's like pockets. You can't, and you kind of, you've talked about this a lot. You can't lump the people who aren't vaccinated into one camp.
No.
And that's why you'll never get to 100%, because you can't market to every single one of these people and force them to do it. But if we can get to 90%, and I think that's doable, we could be like Denmark. But Alberta's got a long way to go. Canada's got a long way to go. But it's what we need. And let's get our freedom going here. Come on. I want to get back to normal.
I want to get back to
normal.
It's so
frustrating because we know that this vaccine's the solution. It's like, God.
Oh, and did you hear today that they've changed the names of all 3 vaccines?
What are they?
I don't know, and I refuse to use them. It's going to be Pfizer, Moderna, and AstraZeneca for the rest of my life. Like, one is Spikevax. I think that's AstraZeneca.
Really? Marketing.
And one is
making some money.
Oh yeah, what's the Pfizer one? It's like Comirnaty. It's like COVID, mRNA, and community all smushed together. Like, I don't know.
It's probably
people are going to be like, is that the Pfizer one? Yeah.
Because the AstraZeneca, that's the name of the companies, I guess, right? They wanted to give it a brand.
Yeah.
So, and there'll be generic ones that will come out. Certainly in Canada, we'll have generic versions of this. We already had the Indian variant version of our AstraZeneca. For those people like me who got the vaccine AstraZeneca right away in April, most of us got the India version of it.
Yeah.
It's called something else. I totally forgotten what it is. Anyways, and so on my card, it shows that I didn't get AstraZeneca. I got this other one. So actually rebranding and giving a different name might actually help me because frankly
because it gets confusing. It is the same
thing.
So let's do a little bit more about this. Okay. So you were talking, my column last week was trying to not make assumptions about people who are yet to be vaccinated because I did connect with a number. There's quite a community of people who are very, 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 very afraid of needles. But having the conversation seems to be helping. I'm up to like 5 people who have gotten it done. There was the one woman that I told you about last week on the podcast whose husband's an anti-vaxxer, and she did send me a picture of her card. She got it done. Her kids are very happy. I resisted the urge to ask how her husband feels about it because it's none of my business, but I'm just really glad and proud of her for getting vaccinated. And the good news coming out of the United States, or Pfizer BioNTech has announced that it is their trials in kids under the age of 12. So 11 and under are moving forward. And the hope is that there might actually be a child and infant vaccine by late October, which, I mean, science, we are witnessing some unbelievable, and I get it. Like, as a parent, it's not easy to get your child vaccinated with any vaccine.
God,
they're pristine.
Quinn,
they're perfect.
Youngest, it was
right?
like when he was like literally holding him down to get anything, blood, he's fine. Now he's into it. So now he likes it. I'm like, that's you go from one extreme to another. But yeah, it's not a comfortable situation, and you have to respect their fears. I don't, who likes getting blood taken and you watch it, like, oh, this is kind of creepy.
My mom was a lab tech. I can't even tell you how many times I've had my blood taken. Let's talk about though. She'd be like, no, she'd be like, you think you're sick today? You can't go to school, huh? She'd swab my throat and call me at noon and say, get to school.
You're used to swabs up your nose.
Oh yeah, my throat. But let's talk about the, the frontline worker, like my mom. I mean, when I watch those protests outside of hospitals, feel free to protest wherever you want. You can cut off traffic arteries, but don't cut off the arteries to emergency help. No,
but now we got
people
with the nurses though. Like, it's, to me, the decision by the nurses union not to support the province's decision to mandate vaccinations for healthcare workers. Their argument is that we'll lose too many staff. If 5% of the nurses get fired, that's a lot of nurses because they don't. So it's a good argument, but unfortunately, it's feeding into what you just described. Those people who are saying, "See, nurses don't want. They are scared. They are against the vaccines." You're like, "Oh God."
You should see my DMs.
I don't know why those nurses don't want it, but it's like any other normal sector. They don't. 5% is average.
I have my direct messages on my social media. My DMs are open. Sometimes I regret it, and sometimes I'm grateful for it. I'm really shocked at the number of people who are reporting, like saying, you want to do a story? Because this nurse, male or female, this nurse is on their social media actively sharing disinformation, anti-vax rhetoric, and anti-science. And for me, I don't, and one of them is at Children's. And I looked at that and I thought, no, come on. No, that could be any of our children that go in there and are dealing with somebody who doesn't believe in the science, that they are there. Like, the difference between a doctor and a nurse is the Hippocratic Oath, right? Like, the doctors do no harm. That is it. And I'm the huge advocate for nurses. 99.999% of nurses are angels who walk among us. We've talked about that a million times, but this small, tiny percentage, I mean, it's just.
But now they've been empowered by their union.
Yeah.
So I mean, it's just a real problem. And I don't know. I get it is a problem too if we lose a bunch of nurses. How does, there's already hard finding nurses for the system, and certainly with the pandemic, even harder.
No question.
So, but that argument it's also going to distract or it empowers the anti-vaxxers. It also discourages people from wanting to get into nursing. They're like, what is kind of industry is this?
Yeah. And it's already
you don't
one of
believe
the
in
world's
science?
most difficult jobs ever. Like, it's already a thankless job with too much
I have
overtime.
Two of my sisters are nurses. So
see, we'll thank them for us.
Yeah, two are nurses and two are artsy fartsy people. Like, you gotta balance the family out.
Well, what about teachers as well? Nurses and teachers, similar. So like, and the different handling here of, for me, it feels like the messaging. I get it. The nurses.
The teachers aren't about science.
No, they're not.
Science, but they're not trained in the sciences of the medical community. I mean, that's where you really go, okay, well, this is a credibility issue now. Teachers can argue and you could say, whatever, but they don't seem to get. They've been political, but they've been more about more strict things, if anything, within schools, not about loosening things up or not being, I don't know if they would support if they mandated vaccinations for teachers, what that union would do, but
I asked Terry Mooring that, actually. I asked her that, and she goes, you know what? I don't think a mandate is necessary because the uptake has been so significant. And we've talked about it. It was like amazing race for teachers. It was like they were rushing around trying to find the pop-up clinics to get the AstraZeneca, whatever, 6 months ago. But where I was going with it is, I believe that nurses work incredibly hard, and the amount of mental health struggles and the lack of supports and pay and just support in their work environment day in and day out has got to be difficult pre-pandemic anyway. I've lost 100%. Count of the number of reports I've done with the nurses union and those conversations. It's awful, but the difference really, it feels right now, is that teeny tiny percentage are forgetting about who they're there for, right? Like if you're, and where the teachers, while they've had, some Terry Mooring, like, this is what we need mask mandates, we need this, we need that, And yet at the end of the day, she's like, I'm doing this for your children. Like, and all the teachers last year, I can't believe how the teachers pulled it off here in this province, really.
Yeah, we were a leader for sure, how we ran the schools last year, and kudos to the teachers and kudos to the decision makers. I know for me, with my youngest in elementary school, it was, and now he's in high school. But I know you had a high schooler. It was quite a different experience for
Very
high school.
Different.
But elementary school was pretty as normal as you could make it last year.
Yeah.
And I think that's impressive. And they did that. And the kids did it too. The kids were all in. I really think that, we were kids once. I didn't listen much. I was a bit of a, but I see kids, and it's impressive what they're willing to do and sacrifice for all of us. So
adaptable.
Anyways,
adaptable. And your youngest is in high school now. How's that going? Your weekend?
Good. Yeah, he's in a new school. It's a good one. It fits his personality.
Sweet.
It sucks because they have to wear masks again. They thought they wouldn't have to, and
here
we are. That's it.
I would have loved to have worn a mask. No, in grade 8. Just hide behind my
big
mask.
braces?
I was just so nervous about being in a big school with the big people, and then I loved it. So I
was only 4'8" in grade 8, so I was invisible already.
I love that.
Little guy.
Oh my God, that's so funny.
Let's
talk. We've only got just a couple minutes here, so I want to make sure that we get to our local politics, because there have been yet again. It feels like, what are we going to talk about this week, George? Let's start with the policing, because that is a huge shift.
Yeah, well, last week we talked about the crime rate, the crime issues on Davie Street, which is in the west end of Vancouver. If you live in the city, and if you know the city, it's sort of it's the LGBTQ area. Really, it's a gay community.
Goes down to English Bay. It's the one that goes
down to English Bay. It's full of great stores and cafes and restaurants, and very vibrant area. I lived there for a long time. And we were hearing a lot of stories. I live in Yaletown, which is right next to it, which is sort of in the Granville Street. The main party street is in between the two. And so we're hearing all this stuff, and you certainly sense it when you live downtown, that crime is getting worse. Break-ins are happening. We have a real problem in our building with break-ins and car thefts, and people smashing windows and cars in the lot, and all these things. And so it reached a head last week. And then this morning last night there was a murder at a hotel not right in that area, but close. Gang style thing. And so this morning the police announced that they're changing the way they patrol, as far as they're going to reassign some of their teams, more street patrols, beat cops, hopefully. I think that's what we heard. Some of the retailers were talking about that. I think it's a good decision, but you sort of go, come on, why? Why do these decisions have to take so much, like, why is it can't just, these police know this and sense this, and it takes so much media attention and potentially a murder to make a decision? It's not a slam on the police, but there needs to be some nimbleness to this. I've been talking about this about being in Yaletown and how crime is getting worse, and there are reports saying, oh, no, it's not, and one of the problems is a lot of the crime you don't report. You just go, what's the point? A friend of mine, I think I mentioned this, friend of mine was beat up at McDonald's at Tinseltown. He didn't report it. Say, what's the point? He just went home.
My car was tossed last night. Again, I don't report it. Because when I phone in the non-emergency line to report it, as I've been told to do, and asked to say on the radio, I call in now, I get the call center person that's like, yeah, you're going to need to go online and find a way to report it there. And I'm like, can I report it right here? No.
At least get the report in. It's just a data.
Something.
If you call
311,
you got it. Yeah. And so you have that data. Just like, okay, we had 5,000 calls
in that block
who said this one sentence, or I don't know, like, get us better data points. If people aren't bothering to call because they think there's no point, the point of calling should be just at least to tag that as a number so that police can see, wow, look what's happening over here. Mm-hmm. And technology.
Maybe we should deploy people over there. Maybe we should redeploy so there's more over there around that time of day.
Why do we have to wait for CKNW and the newspapers and other media and TV to do stories on this, and one retailer who goes, of a wine store on Davie who goes ballistic saying, what the hell's going on? It takes that for somebody to finally listen.
Yeah.
This is not how our society should work. And I blame the council who haven't put their commitment behind the police the way they should. And the police whose inability, and this battle is going on between the mayor and the police. It's like they're all fighting their little things instead of focusing on what you're supposed to be doing every day in our city, taking care of us.
You actually sent me a tweet yesterday that Francis Bula put up because October 15th, 2022, not this October 15th, but next October 15th. So your birthday is October 15th. So not this year on your birthday, but next year on your birthday, there is a municipal election here in Vancouver. I'm not sure if people have put that in their calendar. Also on that ballot will be park board, as well as mayor and council, as it is. And you don't need to fill out every line. You just vote for who you want.
Yeah, you don't do all 10 candidates. You can do 4, 3, 6, your favorites. So I sent you a post from Frances about Vision Vancouver is back. And I think she was naming some names she'd heard about. Some of them I know of them, and one of them was an NPA-er, so that's interesting. And so it'll be interesting to see, but they're looking for candidates. They're going to run a slate. Probably a mayoral candidate, and I would say that's good news for the NPA. Yeah. Good news for John Cooper as a candidate, because it'll split the left. That's the ultimate goal for in order to win. If John can get rid of Ken Sim and Mark Marison, although Mark tends to lean left, I think, a lot of the time, and then John has a chance for sure. If Vision Vancouver comes back strong and Kennedy doesn't bow out, I think Kennedy-Stewart will be pressured to bow out if Vision comes and has a strong mayoral candidate, or if Kennedy-Stewart's the mayoral candidate for Vision Vancouver. Don't underrate. People are like, Vision Vancouver, they're dead. Their brand is terrible. No, that's not how it works. People forget. Good marketing can change things. Campaigns matter. If people look at the candidates and they look at the parties and they go, okay, NPA, too many right wingers, too many crazy people on that board. No, anti-LGBTQ, all those things that we're hearing, that whether or not they're true or not, these are the things that are out there. It's certainly going to hurt them. The campaign will focus on those negatives. It's totally possible that Vision could win again. Absolutely. If Gregor Robertson had run last time, he would have won as mayor, 100%. In that slate, and then on the people that ran, they weren't good enough. Kennedy-Stewart got 900 votes against Ken Sim. Neither of them kind of got anybody excited. I totally think that Gregor would have won again last time.
It's unbelievable.
The people he was up against.
Right.
So don't underestimate Vision Vancouver. They're coming back, and they could win it.
You got to make sure you vote. That's the thing. Yes. Municipal elections in particular, politicians love it when you don't vote. They rally just the people that they know will vote for them, and then they just sit back. It's better if you don't vote. You got to get to the polls And please make sure that you do in this federal election as well. Obviously, whenever you're listening to this podcast or watching it, it is Monday, September 20th. Make sure you go to the polls, cast your ballot, and do so.
It's easy.
It's so easy. I did mine mail-in this year because I didn't know where I'd be
we may not know who the winner is because of you and all the other people. By our next show on next Thursday, we may not know who the Prime Minister is.
I will have gone all the way to Montreal and back. Hey, you know what? We're at 30 minutes. We got to go because we're the fastest 30 minutes in politics in Canada. Unspun podcast with George Affleck. I am Jody Vance. Read my column. The middle is at the orca.ca. Sign up for the Fin while you're there. My column is just an idea. Everybody's so angry about hospitals and hospitals being overrun by unvaccinated or under-immunized COVID-19 patients, putting others at risk who need care. And instead of it being a fight, I just threw an idea on the table, and I'm just trying to find some middle as I do.
Provocative. So, read it. It's provocative.
Thank you very much. See you next
later,
week, George. Bye.
Bye-bye.